CADIS, created by surgeons for surgeons.
Bonjour docteur.
Bonjour monsieur, comment vous sentez-vous depuis l'opération?
The innovative and disruptive medical device, the CADIS system, provides to surgeons an easier and more selective dissection of pathological tissues and fibrosis, which also leads to less side effects for the patients due to the preservation of damage to any noble structures.
Oui, super. Merci docteur.
CADIS is a combination of a pharmaceutical drug, which is located here, and the other one is the dissection instrument. So, the drug, how does it work? The drug is able to attack what we call disulfide bonds in proteins, and will break it. We'll break it in two parts with one messenger attached to each other. And so what's happening is that when you have the structure of the protein, which is like this, if you break the bonds, what's happening is that you change the conformation of the protein, and it will weaken the fibrosis between the tissues. And at that moment, you may come with the instrument and dissect very easily the fibrosis and separate the tissues.
The experienced team achieved authorization to commercialize CADIS. CADIS is used in several countries in the world. Let's listen to some testimonials. The surgical difficulty and the incidence of dural tears and intraoperative bleeding from epidural veins are significantly reduced. CADIS makes the dissection easier, faster and more effective. The cholesteatoma seemed to immediately lose grip from the tissues and OCR after a minute or less from the immersion. The CADIS system can be used in all separative surgeries, such as surgeries where you have to preserve noble structures, separate healthy and pathological tissues, and detach tissues from implanted materials or bone. Here are some of the advantages depending on the surgery type. An easier and complete withdrawal of the pathological tissue without tearing, cutting or damaging the healthy tissue. Less relapses and less side effects. AuXin Surgery. Be part of the future of surgery.